short word about sterility. Every single operative procedure requires completely, perfectly sterile instruments. We achieve that by the use of this autoclave. It treats the instruments at high temperature and high pressure to achieve that perfect sterilization. My assistant, Joy, will explain in a little bit more detail. Sterility of the instruments is achieved and monitored by several mechanisms. Joy, would you explain to us how that works?
One thing we use is a biological spore tester that is used daily to monitor the sterilizer itself, an integrator that verifies that the steam and the temperature is achieved, and also an indicator inside each pack that shows that the steam penetrated and the sterilizer reached its temperature.
So, Joy, do you think that this mechanism is adequate for achieving sterilization for our tools?
I think it's more than adequate.
Thank you so much. Hi, Dr. Tom Trevisani, giving you some preliminary information about your rhinoplasty consultation. Remember, the nose is composed of bone, skin, and cartilage. We can change the cartilage, we can change the bone. We cannot change the skin. Unfortunately, our final result will be determined primarily by the combination of those three tissues and the way they interact. So, we need to be patient postoperatively and wait for our swelling and bruising to resolve before we evaluate the final result. Now, we're using Sevilla here as our anatomic model. The nose is composed, as I've said, of skin, bone, and cartilage. The first thing we can do on the nose is to always trim the tip. The incisions are made inside the nose, so there's no external scars unless we narrow the nostrils, and we'll cover that in a minute. So, sculpting the tip. Then we will always have to narrow the bones. The width of the nose is very important with respect to the aesthetic look of the face. Once that's done, then we will check the profile. Now, Sevilla's got a nice preoperative profile, so we won't need to do much. If you have a large hump, we can remove the hump, giving you a much more aesthetic, pleasing profile. So in review, rhinoplasty, skin, bone, and cartilage. We can change the cartilage, we can change the bone. We can't do anything about the skin. We trim the tip, we narrow the middle, we improve the profile. Postoperatively, you'll have packing and a splint. The packing will usually come out in about 4 to 5 days, the splint in about 10. At that point, the bruising and the swelling will be almost resolved, and we'll see you weekly until completely satisfied. That's the preliminary for rhinoplasty consultation. We'll pick up where we left off in the room, and then we'll go over details at that point. Thank you. Hello, Dr. Tom here, continuing in our attempt to communicate with you pertinent information prior to you and I meeting for your consultation. Keep in mind, cosmetic surgery can help you be your best. We'll help you to make your right choices. Also keep in mind, every operative procedure has benefits and risks. We'll discuss those in detail during our live consultation. I hope that this video has helped serve as an introduction to your consultation process, and hopefully you'll develop some good questions, and we'll move forward now with your consultation. Thank you so much. See you soon.